Welcome to Resilient World. I'm your host, Christine Mormuth, Director of the Adrienne Arsht Center for Resilience here at the Atlantic Council. Resilience is a big tent idea that can mean different things to different people. We at the Atlantic Council see resilience as a mindset, a way of approaching problems with an eye towards figuring out how to build capacity to bounce back more quickly from the challenges coming at us every day. Whether it's terrorism, natural disasters, global pandemics, cyber attacks, or even disinformation campaigns. Resilient World features conversations with individuals who are thought leaders when it comes to resilience. Thank you for listening. We're lucky to have as a guest today Amy Pope, who is someone who knows a lot about resilience, whether it's in terms of global health threats like pandemics or countering violent extremism. Amy is now a non-resident fellow with the Center for Resilience and a partner at Schillings, a UK-based firm specializing in risk management and crisis response. A lawyer by training, Amy started out working at the Department of Justice as a civil rights prosecutor, traveling the country working on cases that ranged from cross-burning to police brutality to human trafficking. After a few years working as a legal counsel in the Senate, Amy moved to the National Security Council, where I met her, and eventually became the Deputy Assistant to the President and Deputy Homeland Security Advisor on the National Security Council staff. During that time, Amy worked on everything from managing President Obama's comprehensive effort to combat Ebola, Zika, and other public health threats, to countering violent extremism, to working on Arctic strategy, and dealing with major migrations of unaccompanied children across our southern border. Amy, thank you so much for taking the time to be with us today.
I'm so pleased to be part of this effort. Thanks, Christine.
We're glad to have you. As you know well, this year is the 100th anniversary of the so-called Spanish flu. It actually didn't start in Spain, but it's a long story as to how it became called the Spanish flu. But whatever you call it, in 1918, it killed more than 50 million people worldwide and infected what researchers believe was between 20 to 40% of the entire world's population. And while there have been major advances in public health and medical technology since then, recent experiences with diseases like SARS, H1N1, Ebola, and Zika all demonstrate that we as a global community are still not fully prepared for the risk of pandemic disease. Amy, you were deeply involved in virtually every aspect of the U.S. effort to respond to the Ebola outbreak in West Africa in 2014 and 15, and saw firsthand how mightily the international community struggled to respond to the crisis. We're looking at the Resilience Center at how to help the United States and the broader international community build greater capacity to be resilient in the face of a future pandemic. There's so much to be done in terms of strengthening public health systems, investing in greater research and development, and working with communities to increase preparedness, that it can really, frankly, be hard to know where to start, particularly in an era of finite resources, which is the case for most countries. So I wanted to ask you, given your experience in the Obama administration with Ebola and Zika, do you think that there are strategies out there in terms of dealing with pandemics that are useful regardless of what kind of pathogen is involved? Or do you think that we really have to look at tailored approaches depending on what kind of disease we're facing?
No, look, I think there are strategies that are worth putting into place that are relevant to any sort of pandemic, that don't need to be tailored. There's going to always be a place for tailoring depending on how a particular pandemic is spreading or a particular disease, whether it's airborne or requires contact like Ebola did. But the bottom line is that that's sort of nice to have. There's so many fundamental pieces that we don't have in place yet. I mean, sort of from where I sat in the U.S. government, what I saw was number one is funding and prioritization. We spend millions and millions of dollars on our counterterrorism response, and for good reason. But when you think about how many people are impacted by terrorism versus the number of people who would be impacted by a pandemic, and you look at the amount of money and resources we're investing, when you look at pandemics, it pales in comparison. And I think that's disproportionate to the threat that's out there. So in the very first instance, I think we need, as a community, a global community, not just in the U.S., to take the threat of pandemics far, far more seriously and invest in it proportionate to the impact that it can have on people. Likewise, I think we need to connect the dots better between responders, researchers, the military, the diplomatic community. I mean, what I've seen is that in general, when you look at pandemics, you're going to be dealing with doctors, you're going to be dealing with public health experts. Connecting those people to the traditional responders is critical. And we saw that in Ebola. It just took time to put these communities together. They're not used to, the Minister of Health is not used to dealing with the Minister of Defense on a regular basis, is not used to dealing with the Department of Homeland Security or Minister of the Interior. And you need to create those channels of communication really early on so that when it comes time for quick response, they're not meeting each other for the first time. And then you need to practice it. So there's the WHO and the Global Health Security Agenda. There have been some great initiatives to create these sort of global tabletop exercises where people are practicing what happens, how do we communicate about this, what happens internally within governments, how do governments communicate. I think all of that needs to be put into place, and I think that it needs to be practiced. And I think really critically to all of this is making it sort of second nature. So it's not in the face of the disease that we're figuring out how to respond, that it's built in. You know, we've done it when it comes to a whole range of other threats, whether it's weapons of mass destruction or other terrorism, et cetera. We've built these communities that know how to respond. We need to take the lessons we've learned and apply them to pandemic threats.
Your comparison of the resources and attention that we devote to terrorism and dealing with terrorism and contrasting that to the resources that we put against things like pandemic threats, I think is a very important one. How do we do a better job of making the case, you know, whether it's internal to any administration or with Congress, which obviously plays a huge role in setting the budgets? How do you think we raise the focus and raise the attention and shine the spotlight on the need for more resources for this area, more attention and sort of policymaker bandwidth? I mean, you know, as you probably remember, we are now getting close to the end of the Ebola supplemental. And so a lot of the money that has been kind of keeping a lot of the important work that the Center for Disease Control has had underway since the Ebola experience is going to have to be pulled back, frankly, because the supplemental is sunsetting and it doesn't appear that there are necessarily going to be more resources. But I think there's a real challenge in making the case for this getting the resources that it needs. And I would be interested in your thoughts on how we can do that more effectively.
I couldn't agree more. I mean, what we saw was we were in the middle of the Zika outbreak, and Zika was raging across the southern hemisphere, and we knew it was only a matter of time before it came into the U.S. And the impacts of Zika were pretty stark, right? The birth defects, the fear, particularly in communities of pregnant women, the uncertainty about outcomes, and yet we were fighting Congress to eke out any bit of money for a preparedness plan. And that was a very frustrating experience, being a responder and having to try to persuade and sort of go into a political machine at a moment of crisis. So I think my takeaway from that was that we need to be building the conversation and the support for what we're doing much sooner. And some of it means that it needs to be about more than just the public health community. There is a very, very important role for the public health community, and this is not to say we need to militarize a response, but what we should be doing is getting other national security leadership to be making the case, whether it's in Congress, whether it's the thought leaders, whether it's around the world. The threat is not perceived as simply a public health concern, but it's properly seen as a national security concern. I think that's really key. It's sort of raising the profile based on the potential impact. I don't fully understand why people react to terrorism in a much more visceral way, but some of it I think is because the messengers around the impacts of terrorism are very credible messengers. And so we need to think about bringing those people, educating them about the impact of public health pandemics, and applying the same sort of analysis, and then pushing that analysis out. So some of it is about the speakers, some of it is about convincing the funders, some of it is about getting the private sector more involved. I mean, there are lots of different angles here. But again, I really am persuaded that we need to take the lessons from the terrorism, the counterterrorism efforts, and apply them here.
That's a great point. I mean, obviously, the national security community and the officials like the Secretary of Defense, the chairman, have a lot of credibility. And I think enlisting them, much as Secretary Gates, when he was Secretary of Defense, was very effective at making the argument for why the Department of State needed more resources. You know, having those national security actors make the case for pandemics as a national security threat is a good idea. Speaking of the involvement of the military, I wanted to ask you, I remember being in the Pentagon when the Ebola outbreak happened, and I remember the very early discussions about getting the military involved on the ground in places like Liberia, with the thinking being that, the crisis was starting to get out of control and something dramatic and significant had to be done, but also President Obama's very strong view that if the United States took a very significant leadership role, it would galvanize others in the international community to follow suit. In all candor, to be frank, I was very concerned at the time about that because, Ebola is a very deadly disease, as you know, if you're infected with it. And we were talking about ordering the military into a hot zone, which, had never really been done on that kind of a scale. What is your recollection of how did you all in the National Security Council have as much confidence as you did in this approach, the idea that, if we went in on the ground, that we would galvanize support? Can you talk a little bit about that?
Yeah, I mean, I think, and I think this proved to be true, so there are two parts to it. One is the U.S. demonstrating leadership and the need for that leadership to bring other partners along. And the second was the role of the Department of Defense and figuring out what was the appropriate role. I think in the first, Ebola wasn't something that clearly impacted the United States or Western Europe. We had when we first saw Ebola break out in West Africa, we thought of it purely as a problem in West Africa, and we weren't thinking about how it might play out across the world. And then as the virus sort of raged through that part of the world and spread to 3 West African countries, and then there were cases, a couple of cases in Nigeria, I think we started to realize that the impact on the rest of the world could be quite significant. If there had been a significant outbreak in Nigeria, for example,
right, much more urban areas, yeah,
absolutely, right. And so, frankly, I give President Obama quite a lot of credit because he foresaw the impact that this could have globally at a time when I think much of the world believed it was really regional. And he believed that unless we took a position and just kind of went all in, that we wouldn't be able to galvanize the support from other partners. But once we did do that, then we had the credibility to go to other partners and ask for their support. At some point I felt like we were sort of dialing for, public health support and logistical support. The president was making phone calls to various leaders around the world. Ambassador Rice was doing the same. Every part of the U.S. government was reaching out to partners to say, look, we're going in. This matters to us, and it matters to you, and we need your help. So whether it was looking for French-speaking public health officials in Canada to logistical support from other places in Europe, we felt like we couldn't credibly make those requests unless we were in. So I think that, to me, just sort of captured the way the president saw the world, is that a little problem could become a big problem, and that we could deal with it when it was still manageable and still within 3 countries, or we were going to deal with the impact of it if it spread further.
I agree with you that President Obama gets huge credit. I mean, again, when I reflect back on my memories of that time, it was certainly not apparent to me that this was going to get out of hand. As you said, he seemed to see it earlier than perhaps others did. And do you think it was just his confidence in his view that it really could get out of hand if it got into Nigeria that made it worth the risk to put the U.S. military, for example, on the ground in that significant way?
I think it was partly that. I think it was he very much took advice from the health community. Dr. Frieden, for example, the CDC, USAID, they were doing analysis of the rate of infection and were forecasting what the impact of continued infection at the rate we were seeing might have. And so his assessment of it wasn't coming out of thin air. It was coming from people who had been studying the disease, who'd been studying other pandemics, and were offering their best views as to what the impact would be. But I think the other thing was Ebola, by its nature, is not highly infectious. It was highly infectious in the context in West Africa, partly for a number of reasons, but partly because the rituals around death and burial required that people lay hands on the body, on the infected body after the person had died. And that body turned out to be highly infectious. And so cultural practices within the communities were fueling infection. That would not necessarily mean that any person who went into the ground or any person who went into West Africa was going to be infected. It was really for those people who were dealing with people who were very, very sick. That was the most critical point where people had to be very careful. What I think the president did well was separate what are the facts and what is fear, and what can we control and what can't we control. And that allowed him to come to a position of the risks to the U.S. military can be managed. And part of that also was being really clear about what is the U.S. military going to do here. We were not sending in doctors. Instead, the military was doing what they do really well, which is logistical support. And then we were recruiting the public health personnel from the U.S. and from partner governments, partner countries, to go in and provide the hands-on support. So I think there was just a very analytical assessment of what the risks of engagement were and what were the risks of failing to engage.
I wanted to pick up on a thread that you raised, which was the issue of fear. And that was a great explanation of sort of Ebola and how it transmits. You do have to be in sort of direct contact, as you know, with the bodily fluids, for example, to catch it. But of course, once you do catch it, it's a terrible disease and is very scary. And another thing that I remember that I think was very challenging, and I would love to hear your sort of observations of it, is the impact of fear on government responses and how that can play out. And I remember, there was a case, as I'm sure you remember very well. I think we had a nurse who eventually contracted the disease because of issues in the hospital here in the United States where she was working. There was the case of I don't even remember the exact circumstances, but there was someone who had maybe traveled from West Africa and who got the disease and was in a hotel someplace in Texas. Those couple of very small isolated incidents, but here in the United States, did start creating a dynamic where it was all over CNN. There was 24/7 punditry discussions of issues. You started to hear people on television talking about, maybe we should shut down flights from Africa, should we shut down the border, and so on. And that does create a tremendous pressure on leaders to do something. And sometimes, President Obama was an incredibly analytical president and used analysis and research and expert advice to inform his decisions. Can you talk a little bit about the pressures that fear and panic can create, and share some thoughts about how to manage that when you're dealing with this kind of a global health threat?
Yeah, look, I remember it well. It was a Liberian national who'd come to Texas. His name was Thomas Duncan, I think, and he'd been diagnosed with Ebola at a hospital in Dallas. And I think we had the mistaken belief that anybody who came to the United States where we had much better infection control practices would be diagnosed quickly, would be treated appropriately, and the infection would be contained. And what happened in that case very quickly unsettled everyone, because it showed the American health community that we were not as safe as we thought we had been. And that created a huge level of panic. And I think that played out in a number of ways. And it helped to have a leader at the time who was comfortable playing a more analytical role. So, for example, there was a question early on, do we refuse to give visas? Do we basically shut down our borders to anybody who's coming from the 3 West African countries? And politically, it was a very attractive decision. From a impact on the progression of the disease and the infection, it could have been very harmful and ineffectual. And the decision in the end was to have everyone traveling from the 5 at-risk countries the 3 at-risk countries funneled into 5 airports in the U.S., where they were evaluated by CDC personnel, and then they were basically they were monitored for 21 days after they arrived, so that we could very quickly react to anybody who was showing signs of the disease. So that was a creative and much more effective response, when we could have just said, forget it, no more visas, people aren't coming in, but then shutting down the help that would have gone into those countries in the first instance. That took a lot of discipline, and it took a lot of political will from the top. But also what I think it did was it taught us a really valuable lesson, which is that we shouldn't make assumptions about how prepared we are. We shouldn't make assumptions about what the American people know about any particular disease. And it directly impacted the way we responded to Zika. So when we first started hearing about Zika, we very quickly got the cabinet ministers and the president involved. We very quickly sought funding from Congress. We started reaching out to partners at the state and local government level, at the foreign government level. We were talking about Zika well before there was any case of Zika in the United States. And so by the time it came here, the level of concern, the level of panic was far lower. The temperature was far lower. Now, that might be partly because Zika and Ebola are different diseases and affect different populations, and so maybe the level of panic would have been lower no matter what. But what we learned was talk about it, get people familiar with it, teach people about how to prevent the infection, seek the funding, start the research, and do that really early. We also very deliberately reached out to the private sector when Zika happened. We were talking to the people who ran hotels and airlines, the hospitality industry, to let them know what we were learning about how to control the infection, about how to spot the infection, et cetera. And I think that was a really valuable lesson that we learned from Ebola. Those people, those leaders within the private sector, can be very effective communicators and bring down the temperature on any of these issues.
To do that, did you all work primarily through sort of trade associations, or did you work through, specific sort of big companies, or through just relationships that people in the White House had with particular people in the private sector, or was it some mix of all of the above?
Yeah, it was all of the above. We were working with the tourism associations. We were working on relationships. We were basically anybody who wanted to talk about it, we would talk about it. We also reached out through non-traditional channels. So I was doing mommy blogs and podcasts and web outreach. Anywhere we thought we could reach people, we would go to them. And we were just very focused on doing that in a way we hadn't been with Ebola.
Fascinating. And of course, one of the challenges, and I think this is always true, in our great American democracy, is you all learned some really valuable lessons from the Ebola experience to the Zika experience. But of course, most of the senior people who worked on those issues have now, left government, and there's a whole new team that's come in. Now, of course, we do have our career people in places like CDC, Health and Human Services, and other places. But I think another challenge for us to work on is finding ways to capture those lessons learned and keep more institutional memory so that we're able to, respond more agilely when the next threat appears.
And I think the really important lesson we learned was you've got to get the message out beyond the federal government. A lot of my time the last 6 months of the administration was spent reaching out, doing talks, passing along the knowledge so that it wasn't entirely resident within the federal government. We also put together a playbook. After Ebola, we brought together a team of people and went through, okay, if this happens, these are the various steps that you should take. And it was sort of a decision tree and meant to be just very straightforward. Here are the things that you should be thinking about. Here are the various stakeholders you should talk to. Here are the global stakeholders, the community stakeholders, et cetera. I think the one place where there still is work to be done is on the funding source. We were not successful in setting up sort of the kind of funding source for any pandemic response. There is some, but it's not at the level that we really need. And what many folks suggested, and I actually think is the right answer, is to set up sort of what we have for FEMA with the Stafford Act, which is some dedicated funding source that can be tapped into in the case that we have some sort of fast-spreading pandemic. And then we are not talking about negotiating with Congress and spending really valuable days, months, et cetera, to get the funding that's needed.
Yeah, that's a critical piece. And I remember how difficult it was to try and get funding from Congress for Zika. Is the playbook that you talked about something that's publicly available or shared with state and locals, or is that exclusively in the federal government?
It's in the federal government, but I think that's something that this current administration should be thinking about pushing out more broadly. It's right, making sure everybody knows what the options are and just reducing the amount of time that people are scrambling to figure out, what do we do now? We had set it up so that we could hand it on to our successors, and now sort of they have it, and hopefully we'll think about how they can push it out more broadly.
Yeah, I think that would be a great thing to do. Let me ask you, Amy, one last question on the sort of pandemic global health issue. There was a commission, you may have been aware of it, that was co-chaired by former Senator Lieberman and former governor and first Secretary of Homeland Security, Tom Ridge. They put together sort of a blue ribbon commission to look at biodefense, but of course, pandemics certainly kind of fall under that rubric. And in fact, I believe that the executive director of that commission is now actually, I think, an official in the Department of Health and Human Services. So some of those issues, some of their ideas may be infused into federal government. But their kind of cornerstone recommendation was to create an office in the office of the vice president that would be responsible for sort of all oversight, planning, implementation of everything kind of related to biodefense, because one of their core findings was that the mission of biodefense is distributed throughout a variety of different agencies all across the federal government. HHS has some budget issues, CDC, the Department of Defense, Department of Homeland Security. There are a lot of cooks in the kitchen. And I think their view was that because of the importance and the gravity of the threat, that it would be prudent to create an office that sort of would bring all of that together, both the policy framework, but also, frankly, have oversight over the budgets to make sure that, there weren't redundancies or gaps and so on. Given your experience in both dealing with this specific issue, but also working at government in very senior levels, I'd be very interested in your view of whether creating that kind of a biodefense czar is the right way to go.
So, look, they're absolutely right that the issue of biodefense is resident in multiple agencies, and you need to find a mechanism to get people together, to share information, to cooperate in the case of a crisis, and to avoid duplication of effort. I think that putting it into the office of the vice president is not something that I would advocate for, only because the role of the vice president changes so much depending on who's serving as the president. And if you have a strong vice president who is really active in the policy space and is really going to advocate for funding, et cetera, that could be fantastic. But in cases where you have a vice president who's playing less of a policy-focused role, then that issue would suffer as a result. I think the better action is actually to put it into the National Security Council, which is why, and we did this late in our administration, but within the last year, within the National Security Council, we set up a directorate that was focused entirely on global health security. And the point of setting up that directorate late in the day was we recognized that there was a need for coordination, that we were lacking it, and that we needed to think. We couldn't just think in terms of this is a Homeland response or an international response. We needed to find ways to marry the different parts of the federal government's resources and expertise. So my personal view is the rest of these issues are put into the National Security Council. Keeping it resident in the National Security Council means that it will it will be taken as seriously as terrorism or defense issues or any other issue that comes up, and that just is sort of more in keeping with the bureaucratic structure. But I think their underlying motivation, bringing everything together, making sure that the U.S. government is firing on all cylinders on this issue is the right motivation, and I agree with the spirit that's behind it that motivated their recommendation.
Great, thank you. Okay, if we can shift gears just for a second, because again, you've had such a rich experience. I'd love to cover another topic, even if not in tremendous depth, and that is talking with you a little bit about another really important issue, and going back to sort of your much earlier comparison to terrorism and the threat of terrorism, and that's talking a little bit about countering violent extremism. And I think we're seeing now, we've obviously successfully dislodged ISIS from Mosul and Raqqa and have, ISIS in terms of controlling territory, basically on the ropes. But as you know, there are going to be lots of foreign fighters moving around the Middle East region and potentially returning to their home countries in Europe or other places. And even we in the United States have experienced going all the way back to, frankly, the terrible shooting at Fort Hood, the issue of kind of, what some call sort of lone wolf terrorism, where you have people self-radicalizing, whether it's through online activity or, meeting individuals who are believers in this very violent ideology. And I would love to talk to you a little bit about your experience in some of the efforts that the Obama administration started to try to grapple with this problem. In particular, I'd really be interested in what you think are the most promising countering violent extremism programs, not specific programs, but what kind of characteristics did you find as you all were working, for example, on the CVE summit that was held? Are there characteristics that you think are particularly effective in programs?
Yeah, so that is I did spend a lot of time working on that issue, and it's something that was very important to the president and to our administration. And what I would say was key, and I've seen this sort of even moving beyond into sort of my next life, is that there's an inclination to try to federalize a response to anything, to any problem. But when it comes to CVE, it really matters. The community itself really matters, and the result where we saw that the effort that we saw had the best results was investing in the grassroots communities. There's a fantastic effort that's global, focused on cities, and what characterizes that effort is that it brings together the mayors, it brings together the healthcare providers, schools, the law enforcement community, the people of faith, and it brings them together to say, okay, we have this, whatever problem it is in our community with whatever brand of CVE, and there's not one brand, and it looks for ways to get to a solution together. And I think that is where we tried to make the investments. It was at the local level, and to encourage various leaders within the cities, whether it was Boston or Columbus, Los Angeles, around the country, we were trying to empower local actors to find the right solution for them. And I continue to believe that's the right answer. It's very dangerous when we sort of talk about, we see this a lot right now, talking about Islam as sort of the feeder of extremism. That's not actually the case in every single circumstance. There are different motivators for extremism, and I think communities need to come to terms with what's happening in their community and come up with a solution. I also think that there's a lot of attention being paid to what's happening online, and I think that is relevant because, as we all know, reaching individuals online is far easier and more covert than it's ever been. But it has to be more than just online. It needs to be focused on who's engaging people in the schools or in the public health community. It needs to be part of a bigger effort. Any sort of online solution is going to be too narrow.
Picking up on that, taking your point completely that the technology piece, the online piece, is not the be-all, end-all to solving the problem. There has been, as you said, a considerable focus on that, and groups like ISIS did get increasingly sophisticated in terms of how they were trying to recruit people. And I think one of the things there's been some debate about is the role of sort of the big technology companies, whether it's Twitter or Facebook or YouTube or Google. And there's been, I think in some cases these companies have been leery of getting involved for a variety of different reasons. And I know at various points, some folks in government have felt frustrated because they haven't felt like those companies were as willing to try to help fight the problem, if you will. Do you have a view on that? Do you think that the companies should be more engaged? Do you think that government is reaching out to them in the wrong ways? What's your perspective on that?
So I actually do believe that the online companies have a role to play here. I think that's clear even what's happened with Russian influence in the elections, right? They're not just a marketplace of ideas. There are ways that people can game the system, can exploit the platforms, can target vulnerable individuals who might be online in ways that I think we don't even fully appreciate. And as sort of good citizens of the world, I think that the online service providers, the social media platforms, have a role to play. And I think there are ways for them to play that role without curtailing free speech. You see Facebook, for example, is grappling with this right now. They do have a team that is very responsive when there are flags raised about hate speech or extremist content being online, and I think that's appropriate. I think the just given the pervasive role that these companies now have in the lives of all people, we should expect some greater responsibility from them. That said, I'm always a little bit wary of governments playing too heavy of a hand here. It is appropriate for governments to seek intervention and to share best practices and to share what they know about how terrorist groups, for example, might be manipulating the internet. It's much more effective, though, when you have the community actors engaging and pushing back on Facebook and others, Twitter, Google, et cetera, and saying, this is not okay. We're not okay with this kind of content being available. And I think that, just from a personal point of view, I think that's healthier when you have community actors engaged, when you have community members seeking certain standards of communication, et cetera. And I think that's more palatable for everyone. That said, I think in the meantime, governments are often best placed to sort of provide information. They're seeing it from a 30,000-foot level often. They're getting information about how terrorists might be, or other actors might be manipulating online tools. And so I think you have to have those channels open between the government and the internet actors.
Amy, thank you so much for taking the time to be with us today. Thank you for listening to this episode of Resilient World. If you enjoyed the podcast, please don't forget to rate and subscribe to us in Apple Podcast Store, where you can also find our previous episodes. We'll see you again in 2 weeks.